Welcome back, everyone. I gotta tell you a quick story. The other day, I was at the grocery store, and I picked up a box of what was supposed to be healthy granola bars for my kid. I flipped it over to look at the ingredients, and I honestly didn't recognize half the words on the list. It wasn't food, it was a chemistry experiment. And it just hit me how completely and utterly we've been conned by a system that puts profits, plain and simple, way ahead of our health. Our grocery stores have basically become minefields, all thanks to an economic model that cares a whole lot more about a corporation's stock price than it does about our family's well-being. But you know what really gets me? The absolute inaction from our governments. For decades, the evidence has been piling up showing a devastating, undeniable link between these industrial products and chronic disease. And yet, they're still on our shelves. They're pushed on us with billions of dollars in advertising, all because they make a ton of money. The very people who are supposed to protect us are instead protecting the economic machine that's actively making us sick. It's a betrayal of our trust, and it's happening every single day. But there are signs that something is finally starting to change.
Okay, let's really dig into this quote, because this signals a huge shift. This is not just another headline or another health study that gets ignored. This is the opening shot in what is shaping up to be a legal war. We're talking a real David versus Goliath situation here. Honestly, this is the kind of accountability fight we haven't really seen since the big lawsuits against the tobacco industry. A major city is literally taking on some of the biggest corporations in the world, and their argument is that the public just can't afford the cost of their products anymore.
So here's what's happening. The city of San Francisco has filed the first lawsuit of its kind in the entire country, and they're accusing these massive food and beverage companies of engaging in, and I quote, unfair and deceptive acts. The central claim here is incredibly powerful. They're arguing that these companies knew their products were harmful, that they were specifically designed to be addictive, and that they marketed and sold them anyway, all while leaving us, the taxpayers, to foot the enormous bill for the healthcare crisis that followed.
So to really wrap our heads around this lawsuit, we first need to get crystal clear on what we're even talking about. What in the world is an ultra-processed food, or a UPF, as you'll see it called? The name might sound a little technical, but I guarantee you it describes something that has become alarmingly familiar in all of our lives. Let's just break that definition down for a second. This is not about your grandma adding a little salt or sugar to a recipe. The scientific standard for this, called the NOVA classification system, defines these things as full-on industrial creations. We're talking about substances you would literally never find in a home kitchen. Things like protein isolates, hydrogenated oils, emulsifiers, artificial flavors. These aren't just processed foods, they are engineered formulas, designed in a lab.
And just look at how common they are. We are not talking about some obscure niche products here. This is, for all intents and purposes, the modern supermarket. It's the chips and the cookies, the sodas, the frozen pizzas, even most of the bread you see on the shelf. It's the breakfast cereals, the hot dogs, the instant soups. They are absolutely everywhere. And they're usually sold to us as the convenient, cheap, and easy solution to our busy lives.
And this is where the sheer scale of the problem becomes sobering. Just look at these numbers. For the average American adult, nearly 60% of their daily calories come from these industrial formulas. And if you think that's bad, look at the number for children, a jaw-dropping 70%. Let that sink in. This isn't really a dietary choice for most people anymore. It has become the default setting for our entire food environment.
So this brings us right back to the core of that lawsuit, the allegation that these companies knew what the consequences were. So what does the science actually say? Well, for years, researchers have been connecting the dots, and the picture that's emerged is frankly terrifying.
Get this, a massive 2024 review that looked at data from nearly 10 million people found convincing evidence that a diet high in UPFs increases the risk of dying from cardiovascular disease by 50%. 50. That's not a statistical rounding error. That is a massive flashing red light for public health.
And it doesn't stop there. That same body of research found highly suggestive evidence for a 40% increased risk of developing type 2 diabetes. And it makes sense, right? These foods are often packed with refined carbs and sugars, but stripped of fiber, and they just wreak havoc on our body's ability to manage blood sugar.
And the damage isn't just metabolic. A major study from 2022 found that men who ate the most ultra-processed foods had a 29% higher risk of developing colorectal cancer. Scientists are still figuring out the exact reasons why, but the link itself is becoming undeniable.
So you see the bigger picture here. This isn't about just one single health problem. The science is now linking high consumption of UPFs to a whole spectrum of issues. Obviously obesity, but also things like anxiety, depression, and even sleep disorders. But the bottom line, it's linked to a 21% increased risk of early death from any cause. That is the devastating hidden cost inside all those convenient packages.
Okay, now, it is absolutely critical that we understand the other side of this fight. What is the argument from the food industry? Because they certainly don't see these as harmful chemical formulas. They see them as an essential, even necessary, part of the modern food system. And they are pushing back hard against the science we just looked at.
So here's how the debate really breaks down. On one side, you have the critics saying these foods are literally engineered to make us overeat. They're packed with industrial ingredients, and they're linked to all these diseases. On the other side, the industry argues, look, these products are affordable, they're convenient, and for many people, they're a necessity. They point out that a long shelf life helps reduce food waste. And here's the big one. They claim there is no scientific consensus and that the very definition of ultra-processed is just too vague and inconsistent to be useful. And this quote right here from their main trade group, the Consumer Brands Association, really sums up their entire argument. They're saying that by focusing only on the level of processing, you're misleading people. They believe we should be looking at the nutrients, the vitamins, the minerals, and that by demonizing these cheap and accessible foods, we could actually end up hurting lower-income families who rely on them. It's a complicated argument, and it frames this whole thing as an issue of choice and social equity. So, with this huge legal and scientific war raging on, what are we supposed to do? You and me, the people actually buying this stuff? Well, while the big picture gets hashed out in court, the choices we make every day in the grocery store, they still really matter. The most powerful thing you can do is learn how to spot these things, to see right through the slick marketing and understand what you're actually eating.
So here are 3 super simple rules of thumb you can use. First, just flip the package over and look at the ingredient list. Is it a mile long? Is it full of words you can't pronounce? That is a huge red flag. Second, scan for those specific lab coat sounding ingredients, things like protein isolates, emulsifiers, hydrogenated oils. And third, be really skeptical of the health claims they plaster on the front of the box. Words like low fat or fortified with vitamins are often just there to put a health halo on a product that is at its core ultra-processed.
And this brings me back to that little bit of hope I mentioned way back at the beginning. Because despite all these grim statistics, I really believe we are at a turning point. Awareness is exploding. People are starting to demand real food, and the market, slowly but surely, is starting to listen. And lawsuits like the one in San Francisco, honestly, no matter how they turn out, are forcing a global conversation that is decades overdue. A conversation about what we eat and who should be held responsible for the consequences. This is a chance for all of us to start taking back our food system. Which, of course, leaves us with the million-dollar question. We can arm ourselves with all this knowledge, but when our food environment is completely saturated with these products, is individual choice and personal responsibility really enough? Or do we need bigger, fundamental, system-level change to protect public health? Is this a simple matter of willpower, or is it a massive policy failure that demands a real solution? I'm genuinely curious to hear what you all think, so please leave your thoughts down in the comments. If you found this explainer valuable, a like and a share would be incredible. And of course, make sure you subscribe for more deep dives. Thanks so much for watching.